Now let's talk about natural history of hernia. What happens to people who have hernia? Rule of thumb is hernia never heals spontaneously by itself. The only group that you have to wait, and there is a chance that hernia heals by itself, is the babies. We usually do not repair the belly button hernia on the babies until they age around 5, because there's still a chance that they heal spontaneously. But majority of babies, even when they come in with a groin hernia, they never heal by itself, and at some point they need to be fixed. In adult population, no hernia heals spontaneously. At some point they need to be fixed. The hernia just gets larger and eventually symptomatic, or they create complications. Of course, it's very hard to predict when the patient gets symptoms or signs related to the hernia, or when the hernia complication comes, and it's going to be very, very difficult to prevent that. So therefore, a rule of thumb is to fix the hernia when you have a hernia. So what is the indication to fix the hernia is when you have a hernia. So if you have a hernia, we recommend to fix it without developing complications, so before you develop complications or symptoms. In fact, people who wait a lot before they get the hernia repair surgery, sometimes they come in with a very, very large bulge. The hernia gets larger and more complicated to perform the surgery. Or they can come into the emergency room with complications related to the incarceration or strangulation of the hernia, which is like a super emergency that you have to fix the hernia overnight or right there, and that put them in a higher risk for post-operative complications. Rule of thumb is the indication for fixing the hernia is when you have the hernia.